Thank you, Dr. Makti, for the generous introduction. So today we will be having a state-of-the-art lecture, two state-of-the-art lectures. The first is going to be presented by Dr. Rupan Gill. Today I will have the pleasure of introducing a colleague and a friend, Dr. Rupan Gill. Dr. Rupan completed her medical school training at the University of Toronto, residency at the University of Ottawa in obstetrics and gynecology, and fellowship in family planning at the University of British Columbia. She received her MPH from Harvard School of Public Health. She has published in a number of peer-reviewed journals, worked as a medical officer at the World Health Organization Department of Sexual and Reproductive Health. She is a recipient of a number of grants to support her work that intersects family planning, digital health, and humanitarian development context, with a project currently in Venezuela. She recently has won a huge recognition as Canada's top 100 most powerful women just a week back. So I have the pleasure of introducing Dr. Rupan, and Dr. Rupan will deliver her state-of-the-art lecture.
In progress.
Hi, it is my pleasure to present to you today on the work we have been doing to improve access to comprehensive abortion care in humanitarian contexts. What we will be covering today is to discuss the importance of context-adapted and community-led co-development of digital health solutions to facilitate self-management of abortion and contraception care in challenging contexts. Present an example of the development of a human and community-centered digital tools for self-management of medication abortion in a humanitarian context, and highlight the learnings through digital self-managed care tools with emphasis on self and community care to navigate complex contexts. I wanted to start to share Vitala's story. Vitala Global is a not-for-profit organization that was founded in 2020 with the support of Options Grant through Grand Challenges Canada. We started as a team of 2 and now are supported by a team of 12 local Venezuelan staff, 5 global staff, and a host of volunteers, students, and amazing partners. The intention behind Vitala has been from our own experience as providers, advocates, activists working at field level with MSF, to policy guideline level with WHO on the need for really spending time with women themselves to understand their lived experiences and to then co-create solutions that can facilitate and support care of abortion and contraception. Building solutions with the local context in mind, centered around reproductive autonomy, is a core value of ours. Bridging abortion and contraception, restrictive settings, and open access harm reduction digital tools is our focus. Over the course of the 2 years, we have utilized a vigorous human-centered design process to co-design a digital platform to facilitate and support self-managed medical abortion with Venezuelan women and their communities. However, it is not just about human-centered design, but it is how we as a collective build a movement and bridge the self with their community and the context in which they are living within, with the goal to facilitate access to quality and supportive abortion and contraception care. To inform our method, we are committed to 6 design principles that run through every product we co-design with women and people of childbearing potential and their communities. These design principles embody the Vitala Global values to ensure that we are equitable, inclusive, authentic, credible, inclusive, results-driven, agile, and female-led throughout every aspect of our work. We are deliberate in ensuring that we stay true to our motto of local solutions for global problems. This is Fexibel. She was 24 years old and the mother of 3. A young Venezuelan woman living amidst the economic crisis. She was unable to afford basic necessities, let alone a contraceptive of her choice. She was pregnant and sought an abortion through a clandestine clinic. It was performed with a hook, punctured her uterus, and she hemorrhaged to death. Globally, every 23 minutes, a woman dies of an unsafe abortion, a cause that is entirely preventable. Our solution, Aya Contigo, is for women like Fexibel. Venezuela is a country that has been facing a protracted humanitarian and economic crisis. Failing healthcare system, poverty, scarcity, restrictive abortion law, criminalization of activists, stigma, the COVID-19 pandemic, misinformation, lack of judgment-free, compassionate care, and isolation. Aya Contigo accompanies users through a safe medical abortion and family planning journey, providing them with an evidence-based, reliable, private digital resource to avoid unsafe abortions. Through initial seed funding from Grand Challenges Canada, we co-created Aya Contigo. It has complete offline capability, WhatsApp notifications, and live chat support. Aya accompanies women and girls to safely self-manage their medical abortion in a supported and judgment-free manner. During the COVID-19 pandemic, our entire intention was, actually prior to the pandemic, to conduct our research and our human-centered design research amongst Venezuelan women and girls on the ground in the field. However, the COVID-19 pandemic happened, and so we had to quickly pivot and complete our research completely remotely. And so actually that is something that we have gotten very good at doing in an ethical manner. And so our entire research was done through social media ads, through Skype interviews, by using Zoom and other modalities, which I will get into. Our co-creation process entails the following. We do a deep dive contextual analysis, conducted a thorough stakeholder mapping of the key players within the country, user-centered research that included quantitative and qualitative methodologies, user-centered design that went through iterative process with both stakeholders and users, user testing of initial prototypes, iterating on that prototype, and then conducting a real-time feasibility and acceptability pilot trial to evaluate the feasibility of Aya Contigo. So for the first phase of the study, which really entailed sort of a formative piece and truly understanding the context, understanding the way that people engage with technology, we targeted 3 million Venezuelan women and girls of reproductive age and ran an online survey using Facebook and Instagram ads over 6 days. 1,148 Venezuelan women responded with a 71% response rate. 851 respondents, which led to 850 respondents. So of these respondents, it was great because we were able to really get a good sense of how people connect with technology, what they would want from a digital solution, and what is the current context within Venezuela. When asked where they go first when they have a question about sexual and reproductive health, 83% searched the internet, 55% asked family, friends, and 55% stated they would go to a trusted SRH clinic. Overall, participants were not concerned about searching terms around abortion, contraception, and sex. In terms of their preferences of how to receive sexual and reproductive health information, 75% stated by email and 70% through WhatsApp. The most common contraceptive methods used include male condoms, implants, contraceptive pills, and IUD. Over 50% encounter problems accessing their contraceptive method of choice due to high cost and it not being available. 42.7% reported an unplanned pregnancy. 19.9% reported having an abortion, with 62.7% stating that they used pills and 36.1% a surgical procedure. 40% did not have an abortion, but 20% stated that they knew someone who had an unsafe abortion with traditional herbs or coat hanger. 71.6% had difficulty getting an abortion, and 48.5% got help from someone. So this here highlights a bit more in terms of the details, and particularly when we asked the users what kinds of challenges did they face when getting an abortion. 50% stated that they would be afraid something bad would happen to them. 20% didn't know who to ask for help. 20% didn't know what to do. 19% said it was very expensive, and 15% were scared of getting arrested. For the qualitative findings, we interviewed 12 women living in Venezuela who had completed an abortion. This was done completely remotely with a UX UI researcher through Skype as well as Zoom. Vast majority were from Caracas, and the age range was between 20 to 39. The qualitative analysis was completed using thematic analysis by 2 independent researchers who reviewed the transcripts, coded for key themes using Atlas TI, and reviewed to synthesize codes into key insights and learnings. We concluded through the qualitative interviews that the impact of the complex humanitarian emergency in Venezuela impacts women's economic and social empowerment. Complex emotions accompany decision-making, fear, guilt, and confusion, particularly around fear of prosecution and safety of the process. Emotional support is needed in the moment of an abortion. Most women sought contraception after their abortion. However, access limited due to cost and stockouts. Internet connectivity is a major issue and needed to be considered in the development of the digital tool. Rampant misinformation about abortion puts Venezuelan women at risk. The internet is the first source of information, but the experience of women themselves was also shared as valuable. Lack of sex education is a major barrier in understanding their bodies. What was very interesting is that most women know how to use mobile apps, as many had menstrual tracking apps on their phones. And Venezuelan women shared they would download a mobile application that privately guides and informs them through their abortion and contraception needs. Key digital tool features identified from the interviews included that it needed to be secure and private, chat groups or forums, up-to-date information, visually appealing, requires little phone memory, able to be used offline, easy to navigate, shareable through social networks, captivating imagery, and not only abortion specific. And so we have 2 quotes here, and I'll just highlight the second one. I tried it like twice. I didn't know either, but I was searching the internet and there were things like cinnamon with rue, cinnamon with malt, but that really didn't work at all. And they taste horrible. In reality, when I searched in Google, it did not put abortive plants because I Googled what shouldn't a pregnant woman take because it produces abortion. Because if you were looking for how to have an abortion, nothing showed up. After completing the synthesis of data from phase 1 and 2, we worked with our team of trusted Venezuelan partners, UX UI design researcher, and conducted a number of storyboarding sessions to identify the initial design of the digital tool. Content was developed by the core research team based on evidence-based WHO guidelines, and the initial prototype was developed and tested remotely with 6 users. Aya was designed with over 1,000 Venezuelan women and a dozen grassroots organizations. Every aspect of the design process has included the voices of Venezuelans and our partners, many sharing their personal stories of struggle or those of friends, some survived, some not. The next 2 slides demonstrate the iterative process of prototype development. This was the first prototype, as you can see, it's black and white. Here's the second prototype that was based on iteration from and feedback from our users and our stakeholders. And I just want to highlight here as a key aspect of Vitala Global and the way that we do our work and what runs through our entire value chain is that we really believe in leading an organization that is female-led, and that throughout every aspect, our values around feminist principles are really embedded throughout. And so when it came to our software developer partners, we were really keen on working with someone who was female-led. And so we were able to find that, and it's a not-for-profit organization, Annie Cannons, that is based in the United States. And they are female-led and queer-led, and they essentially train people who have been victims of gender-based violence or sex trafficking to be software developers, and then give them an opportunity to work for them. And so they have been our main tech partners throughout the project. So once we did the iteration and really kind of had a clear idea of what Aya Contigo was, and Aya Contigo got developed by our software developers, it was time to test it. And so this is Aya Contigo. There are 3 ways that Aya Contigo supports users. And I want to highlight this is the Aya Contigo before the feasibility trial, which is important because there was more iterations that occurred in the phase after the phase 3 part of our study. So Aya supports users by providing them with the information and support to have a safe abortion, assisting them with their contraception decision-making, and connecting them to our trusted network. So as part of phase 3, the research question was, among Venezuelan women who are seeking abortion care, is a digital health application, AYA, an acceptable and feasible method to facilitate self-managed medication abortion and to assess their contraceptive needs? Our primary outcome for this was acceptability of a mobile application to facilitate self-management of the medication abortion process, including feelings of preparedness, confidence, and support. We had a number of secondary outcomes and process evaluation indicators, which I'm happy to share afterwards from this presentation. But what I want to highlight is that we had this study run between April to June 2021. And we were able to recruit 40 people in real time that were going through their abortion. And we completed 17 surveys and 13 interviews were conducted. In this process of the research, we really learned and found out that the digital app on its own is not a panacea, and that people were really wanting to connect and talk to us. And what was very interesting is that as part of a recruitment strategy, we had set up this WhatsApp help desk type scenario. And that was only meant to onboard people to the app and recruit them. However, people were using that as well to ask us questions and were really needing more psycho-emotional support. And I'm going to get into that because that actually allowed us to make some changes to the digital platform, which now includes real-time virtual support. But we were also able to hire an AYA care team, which involves counselors that are answering people's questions in real time, and a community engagement team, because we really believed before launching AYA Contigo into Venezuela, we needed to have a local team in place to really build the trust amongst the local community so that they really felt that AYA Contigo is their solution and is part of their community. So 17 survey respondents, the average age was 28, the average gestational age 6 weeks, so about 29% of the respondents, 8 weeks, 18% of the respondents, 9 weeks, 18% of the respondents, and 4 weeks, 12% of the respondents. The abortion medication regimens, Miffy plus Mizo was about 77%, and the Mizo alone regimen, 23.5%. The 10 participants wanted contraception following the abortions, about 58.8%. And there was a range of preferred methods. The most popular were oral contraceptive pills and a subdermal implant, both selected by 60% of those who sought contraception. Only 2 participants were able to obtain contraception at the time of the survey, and both obtained condoms. What's really interesting to see here as well is that when we asked our participants if they felt prepared for the bleeding and the pain that they would expect, 94% felt prepared by AYA Contigo for the bleeding they would expect, and 88% felt prepared by AYA Contigo for the pain they would expect. When we asked our users if they felt prepared by AYA Contigo, particularly around on determining that their abortion was complete and choosing the contraceptive method, to make sure that they took the correct dose of pills at the correct time in terms of determining their gestational age, 100% of the respondents felt AYA Contigo supported them through their abortion process. Most participants described how the humanitarian crisis in Venezuela impacted their decision to have an abortion and the experience. Many cited their personal economic instability and the broader economic instability within the country as reasons for pursuing an abortion. Participants described barriers accessing abortion pills through both the clandestine market and trusted local partners. When trying to access pills in the clandestine market, often on Facebook or through word of mouth, participants described high costs and concerns about the safety and the validity of the pills. Many were only able to access a partial misoprostol regimen. Most participants expressed that they liked using the mobile app and found the information, design, and usability to be acceptable. All participants who were asked stated they would recommend it to a friend. Some participants described how the privacy of the app could be improved to make them feel more secure, for example, by having a password to open it. And most participants felt the app made them more prepared and confident about the abortion process. Many participants highlighted the importance of the accompaniment through the WhatsApp chat. They described feeling reassured, being able to communicate with someone, and having more confidence in the abortion process. Most participants were referred from a local sexual and reproductive health clinic. Many were then referred by the research team to local organizations who aided them in real-time accompaniment. Many participants expressed that facilitating this connection with local organizations was critical for them to be able to complete the process successfully. I'm now going to show you a video that highlights a real life story of one of our users that was accompanied or has been accompanied by Aya Contigo. Aya Contigo, the app, and Aya Contigo's care team. Alrighty, so we also have a demo here. My apologies. As we're unable to share the demo as well as the video outside of the presentation. But I'm happy to share this afterwards with anyone who would like to have a look. So moving on. So why could Aya Contigo be a game changer? So we're demonstrating that it is possible through community-led, human-centered design that a digital self-care accompanier can provide stigma-free, safe abortion care. We want to prove that it is possible to have a local solution to a global problem through the trust and connection we have built with the existing abortion networks in Venezuela. We reduce indirect costs and resources compared to traditional models of care. And finally, we are generating the evidence to show that quality digital solutions co-created with communities can be implemented to scale to improve lives for people like Louisa. So the lessons learned, we have learned the importance of offline capability of the app because of the unstable limited internet, the importance of local grassroots organizations and activists for both research and implementation, the need to leverage social media for remote user research, particularly around the COVID pandemic, and as well as working in a complex humanitarian crisis. Importance of real-time support. So the onboarding experience we had during the research that highlighted we needed a virtual chat embedded within the app. Some of the challenges, so ensuring quality, affordable, timely access to the abortion pill. So huge clandestine market, not reliable. And then during the time we were doing the research, the COVID-19 restrictions really limited movement and deliveries of supplies. And women and girls in rural areas, particularly poor reach by social media campaigns, limited smartphone, internet access, and misinformation from friends or neighbors. So what are our next steps? We'd like to adapt and be inclusive of young people. So we're using a photo voice methodology to understand the sexual and reproductive health barriers and facilitators for young Venezuelans aged 10 to 19. We've created a youth advisory board of young Venezuelan people that will be a part of the entire research process, as well as co-creation and implementation of the adaptation of Aya Contigo. Build personalized wellness plans that are tailored to the before, during, and after abortion journey. Consideration of an AI chatbot for the initial engagement with Aya Care team, expansion to rural communities, mapping of trusted healthcare providers, and the expansion of Aya to other countries within the region, similar in context to Venezuela. And of course, we would love to bring Aya Contigo and the concept of Aya Contigo and adapt it to Africa, and particularly Ethiopia, if possible. I often say that Aya Contigo is more than an app. It is a comprehensive digital support system that accompanies Venezuelans who would otherwise resort to a clandestine abortion. Aya is embedded within the existing feminist ecosystem in Venezuela. To date, we have supported 2,200 Venezuelans to have the abortion and contraception care that they needed. We are committed to empowering local voices. As such, our Aya Contigo team consists of young Venezuelans and Latinas with diverse backgrounds and skill sets. Our story of the development of Aya Contigo in Venezuela is something that is not just was not just done alone. You know, this is also something that was done in partnership with so many amazing organizations, which I highlight here. And we continue to grow our partnership base. And actually, one of the key things that's quite important to us is partnership and building trust. And so in any country that we plan to bring Aya Contigo, or the concept, similar concept, the most important piece will be to align with and connect with local partners, local grassroots organizations, as well as partners within the formal healthcare system. Because what we've learned is Aya Contigo, the solution, is becoming a bridge between both the formal system and healthcare amongst providers, as well as the local feminist grassroots movements and community-based type of models of care. So this is just showcasing some of the quotes that we have had from some of our users, that have really stated how much they have appreciated Aya. So, for example, you have honestly provided me with safety and I have felt supported. Thank you for clarifying my doubts and being there for me. I'm very grateful because without the app and you, I would not have been able to do it. And you are real angels. I don't know what I would do without you. So join us as we work towards a world where no individual, woman or girl globally is in a situation where she cannot make judgment-free choices so that to achieve her sexual reproductive health goals. Here you can see our Instagram handles, as well as you can get in touch. Our email is here at hello@vitalaglobal.org. I'm actually going to try to share the video. So just bear with me here because I would like to share a new screen. And I will share the video because I really believe that this is a very interesting way for you all to see a real life story of one of our users. And then we'll conclude with that.
Carmen se nos acercó cuando estaba esperando su ecografía. Ya había decidido usar las pastillas, pero pensaba.
¿Qué tan seguro es? Voy a necesitar atención médica. ¿Con cuántas semanas se hace? ¿Qué puedo comer? ¿Se sangrará mucho? ¿Y si me da fiebre? ¿Alguien se va a enterar? ¿Qué va a pasar? Esto está mal. No es el momento. Simplemente no lo es.
Es mucha incertidumbre y no hay nadie con quien hablarlo, porque su compañero no va a estar con ella. Aunque él no esté en desacuerdo con el aborto, tampoco sabe sobre el tema.
Carmen iba a tener este proceso sola, pero nos encontró.
Navegamos la incertidumbre con ella y guiamos el barco para que evitara chocarse. Ofrecimos información para que no se agotara en el viaje y hablamos de lo que sentía para que pudiese drenar.
Aunque no había otra persona físicamente en su casa ese día, en ningún momento estuvo realmente sola.
So that's it. Thank you very much. It's a pleasure to be invited to this conference and the meeting, and I hope that you will have a great rest of your day, and happy to answer any questions by email at hello@vitalaglobal.org. And again, would love to find ways that we can collaborate and bring our solution to countries like Ethiopia. Thank you very much.
I think we will take this opportunity to thank Dr. Rupan for her excellent presentation and a very inspiring project that she did to enable access to abortion and family planning in very difficult situations. And I'm sure there are a lot of things that are cross-cutting to our situation, and there are perhaps some items that we can learn from. Unfortunately, Dr. Rupan is not online at the moment. If she's still, unfortunately, she have a OR day today, and maybe, okay. I'm just learning that she's back online. If there are any questions, we can forward. Brooke confirm she's online, right? Okay.
Yes,
okay.
hi.
Hi, Rupan, how are you?
Good, how are you? I was able to get some 5 minutes delay here so that I could come in and say hi.
Thank you for joining. So if there are any questions from the group, welcome. If not, I will throw 1 or 2 questions. Okay, so I see that Tasfai have 1 question.
Hi, Rupan. I hope you can hear me.
Yes. Hello.
Good to see you again. It was such a pleasure to have you here on our annual symposium. Thank you so much for talking on such timely and inspirational topic. We really look forward to collaborate more on this area as the future is digital. So we really hope to collaborate more in this area. So saying this, I only have 1 question. So as we start the project, usually the legal and policy situation of the country plays a critical role. So how was that, played any role during, the initiation of the project, or at any point during the development of the project, the policy, the law of the country? I wanted to ask this question because, in some settings, especially in African settings, these things could be challenging as, the law and the policy may be quite restrictive. So was there, any lesson that you can share with us how, this innovative, life-changing digital technology has, handled the policy, the law circumstance of the country, and then, has created this impact that you just shared with us? Thank you so much.
Thank you so much. That's a great question. And I think hopefully you can hear me okay. The main thing for us in terms of how we were able to do this, because, in Venezuela, it's very restrictive. The law is such that abortion is illegal only to save a woman's life. So our entire just even how the process is, like doing that deep dive contextual analysis, really understanding the context even before you start to kind of think about how you're going to build and develop a self-managed abortion tool is so important. And in our case, we were very clear that we're not providing the pills, we're not a service provider, we are providing harm reduction information. And so in a lot of ways, some of our key local partners were similar harm reduction type innovations, like whether it's a hotline or real-time accompaniment. And so that's how we've been able to navigate there. Now, if we were to expand, for example, we're looking to enter Mexico, there the misoprostol is just available over the counter. So there's certain adaptations that we'd have to take in terms of making sure that the app kind of aligns with that context. So, I mean, we're really being very mindful of that. And I couldn't get into the presentation, but the safeguarding and cybersecurity piece was a huge component of our work before we launched. And so I would say that's an area that we've also got very good at. So we did a technical consultation with key players in the region who are also working on digital health. We consulted a group called Técnicas Rudas in Mexico who did a thorough analysis of our digital platform, also interviewed every aspect, various folks that are working alongside and connected to Aya. So just making sure that we are being completely safe and working within the realm of the law in Venezuela. And then we also worked with a legal, these legal experts that are based in Colombia called Women's Link. And they did a workshop with lawyers from Venezuela. And then they've actually been supporting us in creating a document in terms of how to ensure that we are, again, safeguarded and working within the law. So there's a lot of these nuances and processes. So it's not as easy as just you develop the app and you think you can just implement it and it's going to work, right? I actually mention this often the app is one piece, but it's like everything else around it that really has made it work to sustain and scale. I hope that answers your question.
Rupan, before I let you go, I know you're very in a hurry to go back to the clinic, but just two more questions for you. One is, what were the main challenges when you were trying to implement this in Ethiopia? When we are recovering from the pandemic, now we're having a larger number of internal displaced people because of a conflict, and this innovative tool can be of importance in humanitarian settings. And what were the main challenges? This is one question. Two. There are many applications that are available online, but yours is a bit unique. I think you have someone sitting behind the computer, because if there is some women have questions or queries or concerns, they will be able to get someone to reply for their concerns. And how significant is it in terms of investment, and how would this impact sustainability? Over to you, Rupan.
Yes, it's a great question. So I'm going to start with your second one, which is the real-time support that we provide. So of course, like the counselors, we are supporting them, they are paid. And the reality is, like, yes, if we go to another country, we would want to have some localization there. But we have also learned from other international groups that do have sort of the counseling feature in their platforms. For example, Safe to Choose, they have 8 counselors that are supporting their entire global program. And so we think it is actually feasible to have less counselors. And then the other piece is that what we've realized, because we're always iterating on our solution based on data-driven insights. So for example, we have now a lot of data of the conversations that are coming to us via the chat that we could actually consider automating, but we don't think it's a good idea to just have a chat bot 100%. But there's components of it that you could automate, and then that also relieves the burden in terms of the number of real-time counselors you would need. Our vision too is ultimately at some point to be able to connect it beyond just folks that are like lay health workers or counselors, that we can also connect with providers and other types of like cadres of healthcare providers. So that and that's what we're actually looking to do in Venezuela, as I had mentioned, as creating that network of trusted providers. And in a place like Ethiopia, that would be actually a little bit easier, just because of the context of the law, and also where you are at in terms of abortion care and abortion provision. Now, challenges, for sure, working in a humanitarian context and conducting research with folks that are kind of living amidst crises is difficult. I would say the fact that mobile phones and cell phones are quite prevalent, that made it easier. However, I do know from like being on the Colombia side too, one area that we haven't really gotten deep into is the migrants, right? The Venezuelan migrants that are migrating from Venezuela to Colombia, their situation is very different than the Venezuelans that are within Colombia. And so this is something that we can have all of these ideas of how we want to conduct our research and work on it, but we need to be super agile and flexible to the fact that really you have to be responsive to the user and their lived experience. So I would say that the way we kind of navigate all of these, like more of the research challenges, is really, again, it's like building the trust of local partners who are the ones that are, in touch and working with those communities, because they're the ones that are going to help you to really be able to access those folks. And then what else? I mean, the challenge of the COVID-19 pandemic. So you heard me speak about that a little bit in the presentation. So we had to become, fully remote in terms of doing our research. So I think actually now, because we faced so many challenges layered upon each other during this research in Venezuela, I think we find it actually, we feel like we can overcome many challenges because we already started in some place that was so difficult during a time we were having a global pandemic. So for example, like having to quickly be agile and not be able to do your research on the ground. So you had to do it virtually. I don't know if I mentioned in my presentation, but during the recruitment of phase 3, an activist was put in jail in Venezuela. So we again had to pivot and figure out a new way to do our recruitment strategy, as well as remove any reference to any local partners in Venezuela in the app, and also Venezuela itself. So now the app is like very more generalized to Latin America, but if you're from Venezuela, you know that it was co-created by Venezuelans for Venezuelans. so yeah, we had all of these sort of little challenges, but we were able to pivot and figure that out. And I do think we've gotten better and better in terms of thinking about novel ways of conducting research. So whether that's through voice notes on WhatsApp or Telegram groups or Signal, right? Like there's a lot that's now happening that goes beyond the way we traditionally did human-centered design or traditionally did research, and particularly when we're thinking about marginalized, underserved populations.
More questions? Okay, I see one hand. Rupan, are you available? One more question.
No, I'm so sorry. I have to go because the nurses came inside. And
Yeah,
they
I
said,
think it's
yeah.
totally understandable. We look at her like she's a scrub and is ready to go. I really appreciate your effort to join us in this tight schedule. Thank you very much. I'm sure there will be another platform where we can access Rupan, and we will be in touch. Thank you very much.
Yes. And I would love to come to Ethiopia and meet all of you in person one day soon.
Yeah, we will do the invitation. Thank you.
Thank you. Have a great day.
Okay, so we'll move to the next state of the art lecture. Call upon Dr. Mutlu to introduce us.